This is an overview of the patient-centered care plans.
It's a care plan centered on a particular patient based on their condition, whether it's behavioral health, physical, or a combination of the two. So most practices have some type of a generic care plan in place, be it for ADHD, diabetes, things of those nature, and you follow along with what's already in that plan, but now you get into the specifics of the patient as well. Also to include what are their goals, what may be things that they want to achieve, can or can't achieve. It's something specific to that patient, and then it's given to that patient as well so that they can take it home with them and follow it.
A care plan is something that's written up or we've devised to instruct the patient on what they need to do based on their disease state, what issues they're dealing with. But what makes it patient-centered is when it's focused on them, the person. Yes, it's going to be evidence-based. It's going to have the components that would be in an ordinary care plan that one might get, say, at the ER when they're discharged or discharged from the hospital. But what makes it patient-centered is that patient takes part in coming up with it, and it's based on their goals, their desires, what they wish to achieve.
When I think about patient-centered care plans, I think about more emphasis being on the clients. They're actually in the driver's seat. They share the role of decision making. It's making sure that the goals are directly developed by the patient, and it's utilizing their support system, involving those people who are a part of that client's life in the care plan and the goals and outcomes. And so it's more strength-based, whereas when I think about a traditional care plan, it's more so focusing on problems and not so much as the strengths of the patients. And it's more so the clinician taking the role as developing the care plan for the client and not really looking at the things in an environment that could also play a role in helping that client to meet their goals. So I think the outcome is driven more in a positive direction when it's patient-centered and it's built around their belief system, it's their environment, it's their values, it's all the things that they desire to take place in order to produce change and have a positive outcome.
Person-centered care plans are used basically in primary care settings as well as behavioral health care settings. In both types of settings, you do have to ensure that the person is at the center of that plan. If you have a care plan that does not include the patient's or members' goals and ideas and their lifestyle functionalities, even their abilities and inabilities, if you do not have those things as being in the person's ideas, then that does not institute a viable person-centered plan. Most person-centered plans should include a cross-functional type of setting as well, meaning that if the person-centered plan is started at the primary care setting, it should also include behavioral health, it should include any other kind of specialties in the community resources. That would be all-inclusive of the medical neighborhood when looking at the person-centered plan. So we really expect these person-centered plans to be more inclusive of first the person's ideas, the patient's ideas, as well as each point of care that the patient is going to.
Patient-centered care plans are important to patient care because it allows the patient to be a part of the process in comprising their care plans, as well as their families or caregivers or any kind of support persons. It allows that patient to include their own goals in regards to self-management, and it also helps in the monitoring process of the care plan.
Items that need to be included in a patient-centered care plan, of course, what is the patient's condition, what are the directives medically or behavioral health wise that they need to follow, including their medications, any routines that they need to either improve, add, or change. But also, the providers need to look at that particular patient. What are some goals that that patient may want to achieve as well? As providers, we know what the patient needs, but getting that patient to understand that is hard. So helping them set the goals, set the plan by asking them questions. What is it that they want to achieve? What could be potential barriers to achieving these things? What could be potential distractors to them meeting those goals? So those are things that really need to be included in the care plan. And something I've learned recently that I think that we need to consider is also what to do in case of a crisis for that particular patient. I know in the behavioral health world that's crisis planning is a part of what they do routinely, but in the medical side, let's say you have CHF or diabetes. What if an emergency happens? What plans are in place for you and your family to take those next steps without having to worry about it while that situation is happening? I think we miss that on the medical side, so I would encourage PCPs to look at adding that as part of their care plans as well.
Patient-centered care plans should be developed based on a comprehensive assessment. Problems to be addressed should be identified with the patient or member and include the family or caregiver as appropriate. For each problem, there should be one or more goals, objectives, interventions, and a target date.
Before you can develop any care plan, I think you need to really have a good understanding and a good relationship with your clients. Really get to know who they are, learn about their history. I think you have to understand their values, their beliefs. You have to understand the way that they cope, and sometimes it may be negative coping skills that they utilize. And you need to understand why that is so and how to incorporate that and not, pretty much take away from their coping strategies, but develop a relationship so that you can enhance the way they do things. And I think once you have a good relationship with the clients and you understand their belief systems, their values, and pretty much their support and things that have worked in the past, things that they've done in the past, then that can help you to develop your interventions with those clients. You would want to make sure that your interventions really match the behaviors, the problems that the client is dealing with. And you want to utilize evidence-based interventions. And you want to make sure that you're monitoring those interventions to make sure they're effective, that you have strategies that are going to produce desired change in your clients. And I think your plan should always be developed with your clients because that's the outcome. You should always monitor to make sure anything that changes in your client's life that's going to affect your plan and your outcome. So really just having that good assessment, understanding your own biases when it comes to clients when you're developing a plan for somebody else's life, and making sure that that's not at the forefront when you're working with clients to produce a change or a positive outcome in treatment.
The person responsible for creating the care plan would be the care management team member, the patient, the provider. You look at everyone that is responsible for the outcome of that patient's well-being would be responsible for coming up with a care plan. We certainly want to engage the patient and make sure that they're driving the change that needs to take place, that we have buy-in from them. So they certainly need to be a part of developing that care plan, the provider as well. And then if there's a care manager involved that will be dealing with that patient, they would also be part of that.
The person-centered plan being that it is in the person's idea, the patient's idea, the development of the plan should always be centered around the functionalities that the member or patient can or cannot do. It should always be focused on their goals and their ideas that they feel is important to their health, along with the actual primary care provider or the behavioral health care provider, kind of guiding that idea into what is important in the development. For instance, if there was a goal that was that needed to be implemented by by the primary care provider or by the behavioral health provider for the patient's betterment, if they needed to increase or decrease their BMI, then the development of that care plan should say, well, this member needs to get their body mass index down because of their physical condition or because of their behavioral condition that is kind of throwing some things, out of sync in their health care. In the implementation of that, setting the goal, the primary care provider or the behavioral health care provider should say, what is the goal that you feel is attainable? A SMART goal. I use SMART in quotations because we all know that SMART is an acronym for it being specific, measurable, attainable, relevant, and timely. So while we create these goals in the implementation phase of it, we also have to make sure it is directive to the care that the patient needs and that it is, something that is needed in the patient's overall well-being. Now, the way the family members come into play with that, they come in the actualization of their care plan. If we have a patient or a member that needs to have some things completed, for instance, as a BMI or some sort of nutritional assessments or weight loss or whatnot, it's important that the family plays a role in the implementation and actualization of that. For instance, if I'm eating Twinkies all day long, and I have a nutritional goal, then the family can assist me in making sure that I am adhering to my goals. And that's the way the wraparound for the actual care plan and the family support caregivers being included in that. When the patient or the member is included in this care plan, we always have to ask as a provider, is there any person or with whom would you suggest that I include in this care plan as well? We have to get permission from the patients to actually share or include caregivers or family or support into their care plan as being, that other arm to ensure that these things are being attained or adhered to as a goal. So we have to ask the permission of the patient when we look at bringing others into the implementation of the care plan.
Remember, you should only include a patient's or member's family or caregiver in developing or implementing the patient-centered care plan with the consent of the patient or member.
Patient-centered care plans are monitored by, as I stated previously, especially with the self-management goals and any other goals that are listed by care team members. When that patient comes back in for visits and they go over the care plan to see where they are, as well as the self-management goals, they may have self-management tools and diaries that were given out by the care team that allows the patient to kind of manage their own care. So they bring those things in, and the care team can go over that with the patients, as well as if they have a care coordinator or a care manager that they meet with. Those are also ways that you can help as far as monitoring. The patient or the members, their role as far as the monitoring, as I stated previously, with self-management, they can keep up with those goals by using various self-management tools or even a self-management diary where they can write down different things. Let's say, for instance, if they've given themselves a goal of walking 3 times a week if they're trying to lose a little weight, so they can have a little diary of the day and the amount of time they walk to actually be able to monitor the progress of where they're getting for those goals.
The frequency of update on a care plan is going to depend on the frequency of visits, the type of issues that the patient's having, the disease state. You may have a patient that is diabetic who has several comorbidities, other issues. They may be high utilizer. So you may need to update their care plan more often than, say, a patient that has asthma or ADHD that is stabilized in the initial states. You may need to update their care plan more frequently, and then as they become more stable, you may want to stretch it out, because it's going to depend on the individual, and then the structure of the office, what that provider that is ultimately responsible for that patient, the head of the care team, they may decide that all of the care management patients be reviewed every 6 months, unless the care manager decides that there is a need or something has changed in that patient's life that's going to increase the frequency of updates.
Patient-centered care plans should be shared, number one, of course, with the patient, and then any family members, caregivers that are working along with them. But then with the patient's permission too, you have to look at the other organizations that may be involved in their care, or if they're a child that's in school, the school probably needs a copy of that depending on the condition. And again, whoever else is involved in that care, whether it's outside agencies, be they medical or non-medical, but working with them so everybody that's involved with that patient and could potentially have an interaction with that patient due to their condition should probably be included in having one of those care plans.
Patient-centered care plans may be shared only with permission of the patient or member. Listed are those with whom you may want to share the patient-centered plan. For more information on patient-centered care plans, please visit the TennCare PCMH and HealthLink Curriculum SharePoint site at the link on your screen. Here are additional resources for learning more about patient-centered care plans.